One of the biggest issues currently facing the NHS is a shortfall of staff to meet increasing demand. But could utilising the expertise of pharmacists go some way to alleviating the problem? Selina Downs went to Essex to see how Firza provides pharmacists to support GP practices and care homes.
So, two different tests we're going to do today. The first one's a nice easy one, just to check the size of your lungs.
Stephen Foster is a respiratory specialist and a clinical pharmacist. He's helping to take some of the load off GPs at the Longfield Medical Centre in Malden, Essex. He sees patients with breathing difficulties, prescribes medication, ensures it's being used correctly, and carries out medication reviews.
I'll reauthorise your medication for another 12 months.
Every service he offers frees up time for the doctors at Longfield to focus their attention where it's needed most.
I come into the surgeries to run their respiratory clinics, so I tend to look at asthma and COPD, chronic obstructive pulmonary disease. Doctors will send patients to me with, for example, undiagnosed breathlessness, and I'll be the one responsible for diagnosing whatever the problem might be.
Until recently, pharmacists may have been an underutilised resource, but now companies like Firza are putting them at the forefront of the NHS. Stephen's business partner is Asim Mirza. In just 3 years, demand for their services has grown. They're currently supplying pharmacists to 28 GP practices and care homes.
We do face-to-face clinics where patients come in to see our pharmacists and they get a little bit more time than they would with a GP. Something we've started now is multi-morbidity clinics. So they come in to see a pharmacist for up to 40 minutes or sometimes up to an hour, and the pharmacist will look at all of their long-term conditions.
David Barker is the practice manager of the Longfield surgery. He was one of the first to recognise the benefits of outsourcing work to pharmacists. Since commissioning Firza's services, there's been a decrease in unnecessary work for his GPs.
It started off with flu jabs, and instead of our nurses using their time to go out to the home, we would send the pharmacist out to the home, and that developed quickly into medication reviews, the dealing with minor ailments, and also just the day-to-day queries that a care home may have that in the past went straight to the GP, whereas now the pharmacist deals with them for us.
The results speak for themselves. A 34% decrease in requests for a GP from the residential homes under Firza's care, and emergency hospital A&E admissions from those care homes have been reduced to 0.
We are saving the GPs a phenomenal amount of time. We always need to know which days the GPs are scheduled to go into the care homes. Then we make sure that our pharmacists go in the day before. And that day before is critical because we can triage all the work that the care home needs to be attended to, and it's always a lot of work. So things that the pharmacist can do is look through simple medication issues. We can do reviews. We can do medication reviews. We can do dementia reviews, even frailty reviews for our frail patients. These are all things that typically GPs did, but now we understand that we can take that workload off of them.
I open up the surgery about 6:30, 7:15, and we have people coming in at 7:15 who will sit and wait to book an appointment. And we can have a waiting room full of people just waiting to queue. The government want us to work 8 till 8, 7 days a week, and it's just impossible for us to cover all that time with the amount of doctors that we have.
But with clinical pharmacists on the front line, this could all change. The government plans to support an extra 1,500 clinical pharmacists to work in general practice by 2020. It's hoped the programme could alleviate some of the strain on an NHS many believe has reached breaking point.